Welcome all of you to our training session, Ask About Suicide to Save a Life. My name is Jenna Heise, and I'm currently serving as the statewide Suicide Prevention Officer for the Department of State Health Services. I'm excited to bring you this opportunity to learn about suicide prevention. This training session is free thanks to a federal grant. Other training materials, including the PowerPoint, are available at texassuicideprevention.org. Joining me in this presentation is Merily Keller, Suicide Prevention and Postvention Consultant and Trainer for Mental Health America of Texas. In this training, you will be learning about what it means to be a gatekeeper and how to ask about suicide, keep safe, and know when and how to refer someone for help. This topic and training may or may not be a difficult subject for you, but we are here to come together to focus on how to be of service to others and help educate ourselves about suicide prevention. In Texas, we are committed to advancing the National Action Alliance on Suicide Prevention. We have a state plan that is based on the national plan. We take a true public health approach to suicide prevention, making sure that all communities are safe for all citizens and that help is readily available. The new goal in health care and suicide care is that no one has to die by suicide. Picture a community where everyone is committed to the goal of 0 suicides. That is our goal across the state. Now let's get started.
Good morning. Welcome to Ask About Suicide to Save a Life. Ask About Suicide is a gatekeeper training program, and it's a training program aimed mainly at adults. And I can't think of anything worse than sitting through a presentation and not being able to ask your questions. So the first thing I'd like to ask today is, what questions do you have about suicide prevention? This table?
I was wondering, if I'm in a conversation with somebody and I start to get a funny feeling about it, should I actually ask about suicide, or, will that give them the idea?
I'm so glad you asked that question. That is one of the most common myths. We're going to go into that more in the training program, but asking is actually the first step in saving a life. Any other questions? This table.
Could you tell us, there are so many teachers in Texas that are concerned about this issue, but really are unaware of how to receive the training, when to receive the training, where to receive the training. Could you elaborate a little bit on the training process and when and how to be available for teachers across the state?
Yes, I can, and that is the second slide. So you're anticipating it. It's great that you asked that. One thing that I'd like to emphasize is that the website that they can go to is texassuicideprevention.org. And it's spelled out, TEXAS, suicideprevention.org. And there is a section there that explains about the House bill that we recently passed in the last legislative session and gives links to best practice programs in the state. So thank you so much. And I think somebody over here raised their hand.
Are there any differences among races and ethnicities, different races and ethnicities?
Charlotte, yes, there are, and I'm glad you asked that. We're going to talk about that when we talk about sex and gender differences, but the key thing to remember is that suicide is an equal opportunity tragedy, unfortunately. It goes across all races, all ethnicities, both genders, and we'll talk a little bit more about the risk factors that may be particular to certain groups in a few minutes. The key thing that I want you to remember is that if you have a question, please ask it. We don't want you to go home with questions, and if we can't answer the question during our training program today, you have our emails, and we commit to you that we will attempt to get the answer to your question, and we'll email you with it later. I'd now like to talk a little bit about what we have in Texas. And one of the key things to understand is that Texas has a Texas State Plan for Suicide Prevention. And the Texas State Plan for Suicide Prevention you can get at the website that I mentioned earlier, texassuicideprevention.org. And it is based on a national plan for suicide prevention. So there is a continuum between state plan and the national plan. In addition, we are doing this training program and other training programs under a Texas Youth Suicide Prevention Grant, and the project partners are Mental Health America of Texas, the Texas Department of State Health Services, and the Center for Healthcare Services. under that grant, we also support the Texas Suicide Prevention Council. And the Texas Suicide Prevention Council, at the time of this taping, has 29 local coalitions throughout the state and 21 statewide organizations. And I'd urge you, again, to go to the website I mentioned earlier and see if there's a coalition in your area, because we have them located throughout the state. And David, one of the things that you mentioned earlier was asking about the opportunities for teachers. And for teachers, we have a program called At Risk that is an avatar-based program. It is available free for all Texas high school and Texas middle school educators. And that's educators because we want everybody to be able to take advantage of this program, whether they are somebody working in the cafeteria, or whether they are a teacher, or whether they are a counselor, or whether they're an administrator. So anybody can take advantage of that. It's also available for colleges and college-age students. And in the last legislative session, there was a change in the state law that made it a requirement for school districts throughout the state to have a suicide prevention plan. And some of the programs that they might make use of will be listed in this website as best practice-based program. And Ask About Suicide to Save a Life is a program that has been submitted to the best practice registry. So I talked about At Risk, I talked about the Ask Gatekeeper training. One of the things that I want to emphasize is that you are one of more than 10,000 people throughout the state that have received Gatekeeper training. We are grateful to you. We really appreciate your being here. We hope that you'll take this information and take it out to your communities. One of the things I didn't ask is, how many people here, if you could raise your hand, have had Gatekeeper training in the past? Well, for those of you who've had it in the past, consider that this is a review. For those of you that haven't had it, we hope that you'll find it useful not only in your professional life, whether you're working in health and human services, whether you're working as an educator, whether you're a volunteer in the community. We also want you to be able to teach it to others, to be able to share it, because this is a program that is a gatekeeper-based program. So we've adapted it for educators, we've adapted it for medical and mental health professionals, and for others. There's 3 key parts of this training program, and I'm going to ask you to repeat it after me because I want this to be embedded in your mind. So it's Ask About Suicide.
Ask about suicide.
Seek more information and keep safe.
Seek more information and keep safe.
And know where and how to refer.
Know how and where to refer.
It's really important that this is something that just is automatic to you, because in a crisis situation, you're not going to have time to refer to notes. This has to be something that you automatically know, to ask about suicide, seek more information and keep safe, and know where and how to refer. I also want to ask how many people here may have lost a loved one, a family member, a colleague, or a client to death by suicide. If you've lost somebody to death by suicide, it can be something that is tough to deal with. And I want you to know that we honor that and respect that in this training program. If you need to leave, feel free to leave. Mary Ellen Nudd, will you raise your hand? Mary Ellen works at Mental Health America of Texas, and if you leave, she's going to follow you out because we want to make sure you're okay. We don't want anybody to leave here that is concerned about something. So we want you to know that that's a safety net that we want to provide for you. And in addition to that, Jenna Heise and I will be available after the program for anybody that just still has some questions. We want you to leave here comfortable. We want you to leave here feeling enabled to put this into practice. We don't want you to leave here concerned about anything that you may have heard in the program. So I'm going to talk a little bit about what we know about suicide in Texas. There are more than 1.5 times more suicides than homicides. An average of 7.5 deaths each day in Texas. I'm going to say that again, 7.5 deaths each day in Texas. It's the second leading cause of death among young adults. It is the third leading cause of death of teens and college-age youth. And this is a takeaway I want you to remember. Although there's no one cause for suicide, suicide is multifactorial. 90% of those who die by suicide have an underlying mental health or substance abuse condition. Again, 90% of those who die by suicide have a substance abuse or mental health condition. Across all ages, more males die by suicide, but more females attempt suicide. Does anybody have any idea why? Anybody over here have any idea why? Mary Ellen?
Men use guns.
You're right. Men tend to use more lethal means. And one of the other takeaways you can take to this program relates to guns. We're in Texas. I come from fourth generation ranching family. So how many people here have guns in your home? Keep your hand up if the guns are locked. One of the single things you can do to prevent suicide is to make sure that all guns are locked in your home. It is actually the law in Texas, and one of the other things that is on the TexasSuicidePrevention.org website is a list of all the state laws related to suicide prevention. But it is a law that if you have a gun in your home that youth could have access to, and believe me, youth can get access, that gun should be locked. Anything that makes for a pause between a thought of suicide and being able to complete it can save a life. So go home, make sure those guns are locked. Talk to your neighbors, make sure your neighbors have guns that are locked as well. In terms of ethnicity and culture, I know you asked if there was any difference in ethnicity. And one of the things that is really important in Texas is that the highest rate of suicide attempts, and note that I'm distinguishing between attempts and deaths. The highest rate of deaths are Anglo-white males, but the highest attempts are Latina females. And what concerns me, and this comes from the Youth Risk Behavioral Survey, what concerns me is Texas's attempts for this particular population is higher than that of the nation overall. And we are soon to be a minority-majority state. So this is something we need to be concerned about, Texas. And one of the things I want to mention is that all of the fact sheets on suicide prevention that you can get at the website are available in English and Spanish. We try to address this by having it all available in English and Spanish. And then on the other hand, one of the things that Jenna is going to talk about next is about risk factors and protective factors. And one of the lowest rates of death by suicide is among African American females. We think that's because of protective factors. They tend to be better at tending and befriending. So this is something that we can learn from this population group. I'm now going to talk a little bit about the Youth Risk Behavioral Survey. And the Youth Risk Behavioral Survey is a survey that is done across the United States. And in Texas, it's done in cooperation between the Texas Department of State Health Services and the Centers for Disease Control. And what's important about this is that they ask teens questions about depression and questions about suicide. And for the last year that we have data, almost 1 in 3 students felt depressed in the past 12 months. 1 in 3 students. But what's even more important is 1 in 6 actually considered suicide. And then when we think about lethality, 1 in 7 actually made a plan. 1 in 7 students actually made a plan. And that's a high percentage. 1 in 10 students actually attempted suicide. 1 in 50 made attempts so severe that they actually needed medical attention. 33 students in the sample had attempted suicide 6 or more times in the past 12 months. So when we talk about suicide prevention, we're not only talking about preventing suicide deaths, we're also talking about preventing suicide attempts, because you can think of each attempt almost as a practice session. And unfortunately, the more somebody has attempted, or even just one attempt, greatly increases their chance of dying by suicide in the future. To summarize what we know about suicide, from a public health perspective, it is one of the most preventable of tragic deaths. And again, I'm going to ask you to repeat after me. It's preventable if we ask about suicide, seek more information and keep safe, know where and how to refer. We need to recognize and lower risk factors, support protective factors, recognize warning signs. And the person that's going to talk a little bit now about risk factors and protective factors is Jenna Heise, who's the Suicide Prevention Coordinator for the state of Texas.